Thank you. Welcome, everyone. And I'm delighted to be here and give a little talk about skincare. Today, we're going to be talking about aging skin. The objectives of this talk are the following. We're going to do a brief review of the anatomy of the skin. We will also do the natural aging process and what takes place as we age. And the third will be how to slow the aging process and to reduce the signs of aging. And there are things that we can do now. And what can we do to help our aging skin? The skin is the largest organ of the body, and the total area is about 20 square feet. It protects the body from pathogens and bacteria and the chemicals. It regulates the temperature and fluids. It conserves the body heat and coolness. And it also provides a sensory function like feeling cold, heat, or touch. There are 3 layers of the skin. The first outer layer of the skin is called the epidermis. The second layer of the skin is the dermis, and the third is the hypodermis. The skin provides a waterproof barrier. And as we age, the epidermis becomes thin. The melanocytes are the cells that contain the color pigment. They decrease in number, but they will increase in size. And that's why, as we age, we see those brown spots. As a result, the dark brown spots and the liver spots will become bigger and more prominent. Beneath the epidermis, we're now on the second layer of the skin, which is the dermis. It contains the connective tissue, the fibroblasts, the hair follicles, and the sweat glands. It comprises the networks of collagen and elastin fibers, which, when we grow older, we will lose some of the collagen and elastin fibers, and that's why sometimes we sag. And that provides the structure and the support, and also the elasticity of the skin. As we age, the sweat glands are less active. Consequently, the skin decreases in moisture. The collagen and elastin fibers decrease, and visibly seeing the result like sagging and, of course, the wrinkles. The deeper subcutaneous tissue that is made up of fat and connective tissues provides a silhouette. And as we age, the layer becomes thin. Therefore, it increases the injury, and we see those black and blues. And one of my patients had told me that, she said, this is the senior tattoos. The blood vessels loses its tone and elasticity, and therefore easy bruising occurs. A lot of cases, even if you take aspirin of the 81 milligrams, which is a baby aspirin, it exaggerates the black and blue and the bruising in the skin. The fibroblasts decreases the activity and numbers, therefore deeper wrinkles occur and decrease in skin tone. There were also some irregularities on the skin as part of the aging. This is the skin anatomy. It is a little bit, unfortunately I don't have my pointer, but as if you can see the uppermost layer of the skin, that is the epidermis. The dermis is exactly where those little glands are. And the hypodermis, and this is where the nerve endings, the hair follicles, we also have the fat cells and the glands are in the hypodermis, which is the innermost layer of the skin.